to look for their mother's breast. However, many mothers need practical support with positioning their baby for breastfeeding and making sure their baby is correctly attached to the breast. Breastfeeding takes time and practice for both mothers and babies. Breastfeeding is also time intensive, so mothers need space and support at home and work. The second myth is that it's usual for breastfeeding to hurt. Sore nipples are inevitable. Many mothers experience discomfort in the first few days after birth when they are learning to breastfeed. But with the right support, with positioning their baby for breastfeeding and making sure their baby is correctly attached to the breast, sore nipples can be avoided. If a mother faces breastfeeding challenges like sore nipples, support from a lactation consultant or other skilled professionals can help can help them overcome the issue. The third myth is that you should wash your nipples before breastfeeding. Washing your nipples before breastfeeding isn't really necessary. When babies are born, they are already very familiar with their own mother's smells and sounds. The nipples produce a substance that the baby smells and has good bacteria that helps to build baby's own healthy immune system for life. The fourth myth is that you should separate a newborn and mother to let the mother rest. Doctors, nurses, and midwives often encourage the practice of skin to skin, also known as kangaroo mother care. Immediately after birth, bringing your baby in direct contact so their skin is against yours is a very important practice that helps them to find and attach to the breast. If you can practice this within 1 hour after birth and then frequently after, it helps to establish breastfeeding. If the mother cannot do this, then the partner or another family member can step in. The fifth myth is that you should only eat plain food while breastfeeding. Like everybody else, breastfeeding mothers need to eat a balanced diet. In general, there is no need to change food habits. Babies are exposed to their mother's food preferences from the time they are in the womb. If a mother perceives that her baby reacts to a specific food she eats, it is best to consult a specialist. The sixth myth we'll be talking about is that exercise will affect the taste of your milk. Exercise is healthy also for breastfeeding mothers. There is no evidence that it affects the taste of your milk. The seventh myth is that you won't be able to breastfeed unless you do it straight away. It is easier to get breastfeeding started if you begin in the first hour after each birth because a baby's reflex are very strong at that time. They are ready to learn to feed at the breast. If you do not latch your baby on right after birth, do it as soon as possible in your situation. If you need to help putting your baby to the breast, if you need help putting your baby to the breast, ask for support from a qualified lactation consultant, a nurse, a midwife, or other skilled professionals. Frequent skin to skin contact and putting your baby to the breast will help to get breastfeeding going. The eighth myth we'll talk about is that you can never use formula if you want to breastfeed. Mothers may decide they need to use formula on some occasions while continuing to breastfeed. World Health Organization, I must chip in this that it has been advised by the World Health Organization that exclusive breastfeeding for the first 6 months of a baby's life is very crucial and should be practiced by every mother as it has very strong health benefits to the child's proper development and growth. It is important to seek unbiased information on formula and other products that replace breast milk. To keep breast milk production going, continue offering the breast to your baby as often as possible. It can be useful for mothers to consult a lactation specialist or skilled professional to help with a plan that works best for them to continue breastfeeding. The ninth myth: many mothers can't produce enough milk. Almost all mothers produce the right amount of milk for their babies. Breast milk production is determined by how well the baby is latched on to the breast, the frequency of breastfeeding, and how well the baby is removing milk with each feeding, with each sorry, the frequency of breastfeeding and how well the baby is removing milk with each feeding. That is what the amount or the breast milk production is determined by. How well the baby is latched on to the breast, and again the frequency of breastfeeding, and how well the baby is removing milk with each feeding. Breastfeeding isn't a one-woman job, and mothers need support. Support like ongoing breastfeeding, guidance from healthcare providers, help at home, and staying healthy by eating and drinking well. The 10th myth: you shouldn't breastfeed if you are sick. Depending on the kind of illness, mothers can usually continue breastfeeding when they are sick. You need to make sure you get the right treatment and to rest each to rest, eat and drink well. In many cases, the antibodies your body makes to treat your disease or illness will pass on to your baby, building up their own defenses. The 11th myth: you can't take any medication if you are breastfeeding. It is important to inform your doctor that you are breastfeeding and to read the instructions with any medications you buy over the counter. It might be necessary to take medications at a specific time or in a specific dosage, or to take an alternative formulation. You should also tell the baby's doctor about any medications that you are taking. The 12th myth: babies who have been breastfed are clingy. All babies are different. Some are clingy and some are not. No matter how they are fed, breastfeeding provides not only the best nutrition for infants, but is also important for their developing brain. Breastfed babies are held a lot, and because of this, breastfeeding has been shown to enhance bonding with their mother. The 13th myth: it's hard to win a baby if you breastfeed for more than a year. There is no evidence that it is more difficult to stop breastfeeding after 1 year, but there is evidence that breastfeeding up to 2 years is beneficial for both mothers and children. All mothers and babies are different and need to determine together how long they want to breastfeed. The 14th myth, and that will be the last for today's presentation: if you go back to work, you will have to wean your baby. Many mothers continue breastfeeding after going back to work. First, check the policies in your country and your own workplace. If you have the right to time and a place to breastfeed during working hours, you may be able to go home and breastfeed. Ask a family member or friend to bring your baby to you, or to express your milk and take it home. If you don't have the option to breastfeed during working hours, look for moments during the day to express your milk and then feed your baby directly when you are at home. If you decide to give your baby a breast milk substitute for some feeds, it's still very good to continue breastfeeding whenever you are with your baby. Thank you very much for listening, and I hope you benefited from this presentation. Please like, subscribe, and follow me for more health related and holistic topics for healthy living. Thank you very much and have a nice day. This is your one and only Dr. Bones.